Meantime, new concern is growing about long-term effects of COVID-19 in children.
CBS 12's Lexi Null is here with more on what these young patients are experiencing. Lexi?
Jim, Liz, as kids across the area return to the classroom, some unmasked, we're also learning some new information about the potential long-term effects of coronavirus. At this point, there's still a lot to learn, but pediatricians are concerned that some lasting symptoms could be serious and even impact learning in some cases.
We have seen some exercise intolerance, some fatigue, headaches, palpitations.
Local pediatrician Tara Harris says it's too soon to isolate all the long-term symptoms of COVID-19 in children, but she says kids have been getting sicker in this most recent surge, and the effects could be serious. Studies cited by the American Academy of Pediatrics show that anywhere from 11 to 15% of kids could experience long-haul symptoms, including brain fog, moodiness, and fatigue.
As a parent, I have young kids. COVID, I view as a very minor risk.
Florida Governor Ron DeSantis downplaying the impact of pediatric COVID cases in the state during a press conference today. He reported that the overall percentage of cases in children has not grown but remained steady. And he also suggested that many kids who are hospitalized are being treated for something else. They just also happen to have COVID.
For pediatrics, depending on the hospital, it's typically between 20 and 40% of the pediatric COVID positive inpatients are incidentally COVID positive. In other words, they're there for a different reason. They get tested when they come in, and then they happen to test positive.
But data shows that pediatric cases are on the rise in the U.S., making up nearly 1 in 5 of all new infections for the last week of July. And Dr. Harris says if you have a choice to mask your child in school, don't think twice.
To the best of your ability, your kids should be masked at school. The teachers should be masked. Everyone in the school should be masked in order to help prevent the spread of this virus.
Well, health officials with the National Institutes of Allergy and Infectious Disease recently announced that they're launching a $40 million study on the long-term effects of COVID-19 in kids. That will take years to yield results, but they are hoping to learn more about the physical and mental effects that can linger. For CBS 12 News, I'm Lexi Null.